is 5 pence. So this is because our unconscious mind uses instinct and not analysis. So our unconscious is usually fallible and it is also biased, and it makes snap judgments of people we meet, categorizing them according to gender, social, and other characteristics, and put them into group. People who are like us are in group, and people who are not like us are out groups. So it's more likely for women to favor women and men to favor men. But sometimes you want to be in the powerful group and you see that one group is winning, then the women start supporting men. And this is called unconscious bias. All of us have it, and it colors our decisions without our realization. For example, the research reveals that if you are talking in a male voice, all of you will be influenced more. But ladies and gentlemen, for the next 15 minutes or so, you have to bear with a female voice, that is me. My name is Dr. Somia, and I will be talking to you today about the unconscious bias. So just like our bodies, our brains have evolved over hundreds and thousands of years, and that's how we are able to survive. And our brain sorts out thousands of pieces of information, and then it makes decisions. But how it makes decisions, let's have an experiment. A father and his son are in a car accident, and the father dies in the scene, and the son is badly injured. He's rushed to the hospital, and in the operating room, the surgeon refuses to operate, saying, "I can't operate on this boy, he is my son." So who is the surgeon? Yes. But many of the people, when you ask them who is the surgeon, they would not relate a female to be a surgeon. And they would start thinking, then who is the father for the boy? This is unconscious bias. Learning attitude, the stereotypes that exist in our subconscious, and they involuntarily affect the way we think and then how we act. So it happens when our brain makes snap judgments based on the information it receives and then adds meaning to it by itself. And the biases that we have in our minds are actually unconscious biases. They lead to wrong judgments, and they have an impact on our decision making and on our behaviors. So we often say, they are very lazy, and they're born lazy and they aren't smart enough. This is a very common thing that we usually use in our ward rounds as well. But actually we know that most traits are changeable and they can be learned, and we don't realize that it is often due to a situation or a particular predisposition that the person is not able to perform. And actually, he can, if we just put in right effort in that person. So if I ask you, are you biased? If I ask myself, are you biased? So everybody will say, no, I'm not biased. I'm very, ethical. And in fact, the matter of the crux is that every one of us is biased. Most of us say that we are very ethical and not biased, but reality is that we awfully fail short of our inflated self-perception, and we are all biased. So there's a very famous test, which is the implicit association test, which is taken by the Harvard. And you can all Google it and you can all attempt this. It is available online. This is the implicit association test, in which the words or pictures are shown and the participants then associate it with one of the categories. Rapidly it changes from one question to another. And it shows you a score at the end, and that is a measurement of your implicit or unconscious bias. And it has been seen in the research over the analysis of this result over many decades now, that white, Hispanic, and Asians healthcare providers all had similar level of unconscious bias. And black healthcare providers, they showed a lower level of implicit or unconscious bias. So our brains are biased. The human brain is hardwired to make decisions rapidly, drawing upon our associations, assumptions, and experiences, and this is an unconscious act. We are completely, unknown to the conscious brain. We are constantly making fast-paced decisions and generalization about people, places, and things that we encounter. And this is influenced by so many of the things. Our past experiences, which may be traumatic, the way we are brought up in a society, the association of awareness, and of all the things media these days, the information that we get from all sorts of media. So actually in our brain, there are two systems which are working. So this is known as system 1 and system 2. And this was explained by Daniel Kahneman, that is thinking fast and slow. And he explains that 95% of our decisions are through intuition and instinct, which is the rapid thinking part of our brain, which is called the system 1. And only 5% of our decisions, which are actually the rational decisions that we analyze and think and then take decisions, are done by the system 2. So it is more slow, conscious, and effortful thinking, and we do then be making big infrequent decisions, which is 95% of the time. So the fast component, which is the system 1, it is intuition, instinctive, rapid, blind, and I will go on to term VCON, and I will tell you what is VCON. On the other hand, the 5% of our rational thinking is comprised in the system 2 of the brain, which is slow, which is effortful, which is focused, which is lazy, you can say, and you have to think a lot and make an effort to use it in order to take a decision. So VCON, anybody who knows this term? Okay, so VCON was also the term which was coined by Daniel Kahneman, and he said that it is an abbreviation, actually, it's an acronym. What you see is all there is. What you see is all there is. So if you see from the right side, a person is saying that there are 4 sticks on the floor, lying on the floor. But if you see from the right side, he says, no, there are 3. So what is actually the right answer? This is very similar that if I give you this picture and I tell you to read the colors and not the words, many of us would fail. So if anybody can read the lowest line, read the colors, please. Next line. Next line. So we learn a rational thing. But if at a snapshot we look at it, we will read red, blue, orange, purple. What is written, and you cannot read the colors. Similarly, if I ask you, what is the safer method of transportation? Is it an aeroplane or is it car travel? Car travel? How many of you say car travel is safer? Okay, so how many of you say air travel is safer? Okay, so we have a mix. Okay, let's have another one. So what are you most afraid of? Shark. Okay. Okay, so shark, lion, and mosquitoes. How many are afraid of shark? All of you, almost. Mosquitoes and lions? Oh, you're not afraid of it. So actually, the fact is that the chances of dying in a car crash is 1 in 101. And the air crash is 1 in 11 million. Similarly, the WHO estimates that 1 million people die each year due to mosquito bites, not shark attacks. And the statistics show that there are more chances of falling a coconut on your head and dying than a shark attack. So this is what our mind does, and this is what its unconscious bias. So we receive 11 million bits of information every moment, every second. Our mind is receiving 11 million bits of information. and we can consciously process only 40 bits of it. So such a huge amount we gather, but we can only process a very, very tiny bit. And 99.99996% is our unconscious judgmental thinking, which is a knee-jerk kind of a reflex. But this even tiny bit of bias that we have can have big consequences. So the impact of unconscious bias is where you work as a team of doctors, healthcare providers, in which you have a senior doctor, a nursing staff, attendants, patients, and doctors. And if you have these biases, then you are unable to, take right decisions for them, because race, gender, age, religion, country of origin, introvert or extrovert, these are some of the things that unconsciously affect your decisions. So I was just talking to Dr. Taiba, and she said that we unconsciously, see, this is a private medical graduate, he's come from China or Russia, probably he's not going to be at par with the government medical graduate, which is wrong. Similarly, we say that he is lazy, he generally is very lazy. So let's not delegate a task to him. Let's find some active person and give the assignment to him. Similarly, we give a recent proposal to somebody who's very enthusiastic, but we do not give it to somebody who's an introvert and shy and never participates in any activity. So these are the biases that we are constantly juggling with in our mind, and these affect our decisions in recruitment, in hiring, in delegation of power, in giving assignments, in giving performance evaluations, filling their ACRs, in openness to new ideas, innovative solutions, in corrective actions. So many of these things, the positive and negative biases are affecting. So now I'm going to go into some of the technical terms for you. So there is an affinity bias and there are microaggregations. These must be somehow newer terms for you. So affinity bias is when you favor our family members or your friends or somebody you know who with you feel a connection, and that connection can be based on shared experiences or characteristics, and you tend to favor them, and it happens very often. Similarly, there are small sets of verbal or behavioral or environmental indignities where we, pass a derogatory way or smile in a sarcastic way or pass a gender-based or a racial comment and on the religious insights and insults. And these all are done not intentionally but unconsciously. So the affinity bias is the one in which you feel a connection with somebody who's similar to us. And then there's perception bias, which is that you stereotype and assume that this person is very introvert, this person is very lazy. The way he is dressed up, he doesn't seem very impressive and interested in doing an assignment. Similarly, there is a term which is known as halo effect. The halo effect is that you look at the person and you get a very positive vibe about that person. And then you start assuming that he is, going to be very good. It actually happens in the starts of the interviews. A person or a candidate comes and sits in front of a job interviewer and he smiles or he looks very confident, and you assume in the first 30 to 40 seconds that he looks like a good candidate. And then, even if he's not performing very well, you're giving an edge to that person, having that perception in mind that he was very confident, very smartly dressed up, the way he interacted. Although the information or the answers which he's providing is not right. Similarly, if you encounter a person and he is very, he gives you a negative kind of a feeling, he's not shaved properly or he's shabbily dressed up, you unconsciously develop a negative image of that person. And you start, just time pass and then you don't want to take any question out of him or find out how capable he is of doing something. So this is a halo effect and a horn effect. These are two terms I can use. And then there is a confirmation bias. Confirmation bias is that you are looking to confirm your own perceptions and your pre-existing ideas in the form of others. You will agree with me. See, you will start your statement. You know, you will agree now that this is like this, right? And if he agrees, then you start liking them. And if they say no, it's not like that. They said I don't want to interact with them any further. So these are the few small things that affect our mind and our decisions. So that's how we all judge others. So your professor wants to give an assignment to somebody in the ward, and he says, I don't want to give it to Sana. She's unreliable. She can't even come to board on time. I don't want to, delegate anything to her. Let's call somebody who's very efficient, somebody who's very punctual, somebody who is always, present in the ward. Similarly, you can say that the last time I gave him a project, he was very, very average. So let's try somebody else. So you assume on the basis of your past experiences that this person is not going to perform the way you desire. It's your perception. So we attribute a person's behavior to their characteristics, although we don't know in what circumstances, what limitations, what constraints that person might be operating at that time, and how they might have changed now and be able to perform better. So this is how we make judgments. So how can we combat unconscious bias? So it's the way we see the world. So how do we see the world? First of all, we need to understand that it's universal. This unconscious bias is universal. We all have it. So it's not something that makes us bad people. But we should recognize that it's harmful. It can be a challenge to work on counteracting these biases that we all have in our mind. And we also need to know that improving ourselves and getting rid of these biases is not a costly initiative. We can all invest in it, and we should all invest in it. To start thinking with deliberate, conscious efforts to incorporate inclusiveness in our decisions and everybody who's around you and whoever you interact with. So the one term that I told you was affinity bias, that we start liking somebody or we have a personal connection as a friend or as a common interest, and we start liking that person. So if you are in that situation, you should have a team rather than taking the decision alone. And you should also look for people who are unlike you so that you do not develop an affinity bias. So I like him because he reminds me of my youth. So you take somebody who's completely opposite of yourself. That is how you're going to remove your bias. And then you focus on the skills. And in the microaggressions, I told you that passing a comment, a racial or a gender-based or a social setup, or the way they go, these are small gestures which you unconsciously, you give a staring look to them, or you do not pass a smile to them when they're passing smile. Or if a patient is walking to a doctor and he is, constantly busy with his phone and saying, so these are the small things that put off the patient. So we should show gestures of respect every day and provide positive reinforcement and encourage the fair treatment. Be attentive in listening, be a good listening end, and seek input from your colleagues and other stakeholders. We should be aware of our biases, we should identify them and check them rather than being driven by them. And we should also coach our teams to do the same. So whenever a microaggression happens, we should consider what one said was harmful. Be accountable for our actions, and we should be willing to apologize if we hurt someone. Rethink about harmful assumptions or stereotypes. Empathize with those on the receiving end of our microaggressions, and support by offering resources and asking how you can help. So this is what makes us a caring person. So we should all be the caring ones. So I would like to end my talk by saying that leadership does involve a lot of things which were discussed by the previous two speakers, like caring for somebody, to care for your teammate, to have the power to delegate, to conflict resolution, to give confidence to people, to set an example for others. But you also need to be unbiased to be a good leader. A good leader cannot be biased. And 95%, I told you, is unbiased. So we all need to work on it. So leadership is not about being in charge, but we talked about power and leader. It's not about being in charge, it is about taking care of those who are in your charge. So that is how the leaders evolve. So we should all jump over our biases, shun our biases, and empower them. Don't micromanage them. Collaborate with them. Don't mandate them. And you earn respect if you review effectively. So I would just like to end my talk here by just a small point which is very, very clear to me. That the boss guides his men. The leader inspires them. The boss depends on authority. The leader depends on goodwill. The boss evolves fear, but the leader radiates love. The boss says I. The leader says we. The boss shows who is wrong. The leader shows what is wrong. The boss knows how it is done. The leader knows how to do it. The boss demands respect. The leader commands respect. So let's all be leaders and not bosses. Thank you.
Thank you, Dr. Somia. So I might have a question. I'm not sure if you're able to listen to me.
We can hear you, Dr. Ray.
So you discussed about the biases, and then how do you see in the current environment where you practice is the gender bias or the gender in science bias, because that's one of the topic pretty discussed heavily in USA.
I think the gender bias
in personal experience.
Yeah. The gender bias has always been there since the ancient times. And if you talk about specifically gender bias against females, so this International Women's Day, the theme was break the bias. I would just quote you two examples. That whenever we talk about science, the first word that comes to our mind, that scientists are generally men. But we know a lot of good scientists who are females, like our Dr. Afia Sadiq. So similarly, there was an experiment done in a music selection competition where they were hiring people for orchestra and they were all males. So what they did was that they blinded all the judges and they were behind the curtain in the selection. And the next time, the women were more included in the orchestra playing. So the gender bias is, I think, the most important in our society of the unconscious biases that we have. And there are so many things which are influencing this bias. Women are weak, they're more occupied at home, they're not capable of taking challenges, they are weak physically, probably they are not emotionally strong to take up anything. And I think it's time to change this phenomenon, because if I quote you examples from the COVID times, you've seen that the Netherlands was the country which led from the front by a female prime minister, and it did very well. So I think every woman is a superwoman, and all of us start including in giving more opportunities to females, if not equal to men.